Okay, can you sit down? It's not about you, it's about Silver. So welcome back, everybody. So I just wanted to give an update on Silver's vet appointment today. And don't worry, you'll see footage of her because I made sure I got some footage so you can see baby girl. So I took Silver today for a checkup. We did a weight check on her and she is actually now 35 point something pounds, which is almost a 2-pound increase from her last vet visit. I actually thought she was at 34 pounds her last vet visit, but it was 33 point something. So it's basically 2 pounds extra. So basically all the extra food I've been feeding her has actually paid off and got her to gain some weight. As great news as that is, she is still underweight. She's not at the point of, you know, where it's extremely harmful to her, but she is still underweight regardless of that increase. But I was pleased to see that at least something I was doing was, you know, benefiting her. We also ran a blood panel on her. The last time we ran a blood panel on her, either her, I can't remember, it was either her liver or her kidneys were starting to not function properly, like her levels were extremely off. Today when we ran the blood work, all her levels came back absolutely perfect. Like they were all at normal level. Basically everything reset itself. Anything they were worried about and had questions about, it reset itself. And that part is great news and not so great news, because I was hoping to get some sort of sign at this visit with the blood work that it's time. The fact that it came back perfect doesn't help anything when it comes to my decision on when to say goodbye to her. You know, even though blood work can come back perfect, it doesn't mean that there's not stuff going on. That was one thing I always talked with my old vet, was that sometimes blood work shows us what's happening and sometimes it doesn't. Like you can base things off of blood work and sometimes it be correct and sometimes it's not correct. When it comes to her incontinence issues, you know, she's been having them for so long, and the fact the medicine isn't doing what it should, like it started doing what it should. It helped her not have accidents, but that only lasted for maybe, like, I don't even know if it lasted the whole full 2 weeks. I think it was the full 2 weeks when we first started her on it, but the next 2 weeks on that medication, it didn't help whatsoever. There's only one other option for incontinence medicine to help with that issue with her, but I opted out to not getting it because I really don't think it's going to work at this point with how much she's having issues controlling her bladder, and not just her bladder, but, you know, once in a while also, you know, her feces area, you know, her poopies. The biggest issue is still Silver's mobility. Yes, she can walk sometimes, but, you know, me having to lift her to get her up, and also her refusal to get up on her own to, you know, either go eat or to go to the bathroom. The doctor feels that she's definitely probably in more pain than what she's showing me. Today was the first time at the vet office that Silver actually showed her legs dragging on the floor. Like Silver, usually when we go to the vet office, she's very, nope, I'm fine. You know, look, I can walk fine. I can do this fine and all that kind of stuff. And today was the first day where she actually had her legs sprawled and was basically scooting her butt across the floor trying to walk. And when I mentioned about how Silver's isolating herself on her bed and basically just stays on the bed the whole time, and that I really haven't had good days in a month and a half, and also her breathing, even though they can't hear anything abnormal, she did seem to react when she was pressing on certain parts of her backside, but that could also be Silver injuring herself due to her mobility. Like she, you know, when dogs have bad mobility, you know, that's extra strain on their muscles. You know, their nerves aren't working properly, and if they fall, they can hurt themselves that way, like bruising and things like that. Not only is she not able to function properly with the mobility being limited, but you know, the incontinence is causing cleanliness issues. I could bathe her every day and wash her bed every day, which I really try to do for her, because I wouldn't want to live in my own filth. But the vet even agreed with me that doing that is not going to be productive in the long term, because if she is peeing in her sleep, which she is, she's definitely urinating in her sleep. She's not getting up to go even like to try to pee on her floor. And not only, you know, sitting in your own filth can cause, you know, skin irritations and things like that, but me grooming her almost all the time, which I'm not doing full grooms on her, but even washing that area constantly, whether it's just doing, you know, damp rags for light cleaning, or if I'm actually taking her into the shower to bathe her that way, all that washing can actually cause irritation eventually too. And plus it's very stressful for her. Last night actually, when I was bathing her, she acted like she was in complete pain when I was holding her stomach up, trying to hold up her back end just to wash off the poop and pee. She was really frantic for a good while there in the shower, which that was a moment of almost like, okay, it's time. Like I really felt that when I was trying to clean her up yesterday. You know, Silver has a lot of issues, but they're definitely all old lady issues. I mean, her teeth are rotting out of her head. She's got extremely bad breath from it. Her gums actually look like they're putting some weird like film on her bedding sometimes. She does have senility issues. It's not like she's perfectly coherent all the time either. Even though today she could have fooled me, because she almost jumped into the car because she knew we were at the car to go to the vet, and she you know, as soon as we arrived at the vet, she peed outside perfectly fine, and then she did excellent at the blood draw, and she was a perfect little baby girl like she always is at the vet. And after we left, she pooped and peed and then tried to jump in the car again. I didn't let her because I didn't want her to smack her legs on anything, but she definitely tried. I don't know. I was hoping for some kind of definitive answer today, and I, for some reason, can't wrap my head around saying goodbye to my dog for incontinence issues, but incontinence issues really can be a factor on the health of a dog, and not just the dog, but us, because we're smelling the ammonia from her urine on things that we can't get clean anymore. But it's not even the incontinence, the mobility thing's a huge thing too. So those two factors. And Silver's had the mobility issues for a long time now. Even my old vet talked about how it was probably something neurological, where her brain's not sending the proper signals back to her back end. And even our new vet today was talking about that too, about how the nerves aren't responding properly. Like there's some sort of disconnect between her head and back end, where it's not telling her back legs to work properly. And we do see her shake a lot now when she stands up, when she does try to stand up. And, you know, back to the senility, you know, even though I do have my moments where I see my baby girl still there, she still paces in circles sometimes trying to find something. She will stand randomly in the hallway just staring off. Well, she doesn't stare because she doesn't have eyes, but you know what I mean. Like she does similar doggy dementia things, which reminds me a lot of our Kage, because Kage had doggy dementia. They don't call it doggy dementia, you know what I mean. And the vet also said today, even though things look to be decent on blood work, you know, and she seems to be okay, she's not living, she doesn't have a quality of life. And she also mentioned that basically we're starting now hospice care for her. So we're upping one of her medications, and we're adding an extra pain medication to her cocktail of meds, because Silver's also on medication for her thyroid. She's also on medication for her seizures. So there's all these other things, and the fact that she isolates herself so much on her bed, like that's all she wants to do. And she's back to once in a while coming to the kitchen for dinner. The rest of the time she's wanting me to bring it to her. She just basically lifts her head and waits for me to bring her food. And even with her food now, she's not chewing. I've been watching very closely on how she's eating, and she's basically just trying to flick it backwards in her throat to get it down. I wish she could tell me how much pain she actually is in, because I'm worried that I keep getting this gut feeling that she's in more pain than what she's saying due to her mobility issues, her back legs and stuff, because they really do look just in terrible shape. And her muscle loss, there's nothing I can do to bring that back, even though I did manage to gain, you know, almost 2 pounds back for her. It's not enough, and it never will be, because I'm not building the correct muscle, and it's not going to happen because she's a senior baby. But one thing the vet said to me today is that there's really nothing else we can do for her, because you know, there's certain pain medications, if we upped that, would actually potentially cause kidney or liver failure, and then she would be in a whole other slew of things, and that would just cause her more pain and discomfort. So I'm not going that option either. I think a lot about Kage with her situation. Kage had different type of mobility issues, but he was in visible pain from them. He cried a lot, and his senility and his teeth issues I knew caused him a lot of pain and a lot of anxiety. And seeing her mouth, I know enough about vet care to know that that is definitely, if it's not painful, it's very uncomfortable the way her teeth are. And also on today's visit, the vet wasn't very, I don't want to say wishy-washy, but she wasn't very back and forth with letting her go or not like she was last time. After assessing her today, she was very much on board of she's in pain with more than just her arthritis. Like, the vet was very much, this is it. This is our final thing. She's just old. And I keep thinking back to my cat Pandora, who I had for, I think Pandora was 16. There's a potential she was 17. But Pandora did the same thing. She was extremely skinny, and that cat got down to nothing but, like, she was like a walking skeleton in this house. And she started having incontinence issues and just peeing wherever. You know, she lost all her teeth except for one fang. And what ultimately led me to say goodbye to her was when she ended up getting this ulcer in her eye. She also had a huge cyst too growing on her stomach. But her blood work came back perfect too. But ultimately it was that eye ulcer, because the way it was, they would have to do surgery on it, and they weren't going to do surgery on a cat that old and that underweight. And I ended up just saying goodbye to her then too. So it's a lot similar to that situation, where sometimes it's just age. And I keep trying to tell myself to be grateful that I got Silver this far. And but I'm also really pissed off that I'm basically losing her, or gonna be losing her, to her back end, and the way she's breathing. They all said it was kind of like, yeah, it's either pain's happening or anxiety, like something's happening causing her distress. So we're just going to keep her as comfortable as possible. I have to talk things over with my husband more about when and things like that. I feel like it's coming sooner now, even though I know we've kind of pushed it off as much as we can, but I think we can't push it off too much longer for baby girl's sake. And I did take her to McDonald's after her vet visit today, and we shared a plain double cheeseburger. And anybody gonna give me crap about giving my dog a cheeseburger that's gonna cause pancreatitis, you can just go fluff off with that, because her blood work came back fine. I'm sure her old butt can handle the cheeseburger. She probably could handle it better than I could, because I haven't had McDonald's in so long, and it was so salty, and I did not enjoy it, but I'm glad she got to enjoy it. So I'm going to just try to do as many bucket list things as I can with her. Maybe take her to get, you know, one more puppuccino, and maybe fix her a good dinner or 2 or 5 or something. You know, just do everything I can for her. So we already checked off our McDonald's cheeseburger for today, so at least that's the start. That was one thing they said today too, was they think she's holding on for as much for me as I am for her. And the vet tech that was there, oh gosh, she was so sweet. She yeah, she said I've always gone above and beyond for my dogs, especially my baby girl, and that it's okay to let go. I swear, I think Silver would live to 20 if I would just let her keep peeing and pooping all over herself in the house. But yeah, watching her try to get up has been definitely a struggle. But thank you guys for listening, and especially thank you for all the love and support. My phone has been going off like crazy with messages asking about Silver. I don't know, I just get blown away that people care that much about my babies. But yeah, like, subscribe, I don't know, I don't feel like saying that because I'm just such a mess today. But anyway, thank you guys so much for everything, as always, and I will keep you posted on Silver. If I take her for a puppuccino or anything, I'll make sure to film it and let you guys see her, because obviously she's the favorite according to the poll we did, which I was quite shocked about. Very happy about it, but I was still shocked. I thought Sully or Gypsy would win, but I was kind kind of geeking out that baby girl got the most votes. Anyway, take care everyone, and we'll see you in the next one. Bye.